You know, we talked about that too. How many
I
times did
did,
we do flat? Did we do it 3 times?
ah, I think so. Yeah. Twice here and then the Kelowna thing. Was it?
Nice. Yep.
Yeah, yeah. It was, yeah. That was still one of my favorite shows, actually. Gotta admit.
Me
Really
too.
enjoyed
It's
it.
very fun.
Yep, yep, yep. Good.
All right. I don't know who the chair is, but I'm going to shut up now so they can start the meeting. Okay.
Yes. I'll shut up too.
Take care. Nice seeing you.
You too.
We're waiting to establish quorum in case you're wondering why we're not starting on time.
David, I just want to let you know that I'm up online here. We're just traveling back from Edmonton. I'm with John, so John is also here. Just so I'll let you know, just here to listen in. So thank you.
David,
Go ahead.
have you heard? I believe is it Councillor Schmidt Rempel and I'm trying to, and Councillor Parker. Have you heard from them?
I think we're going to be here sooner or later.
Oh, oh,
Yep, I just texted Ryan to get down here, so.
It was
yep.
1:30 right when I came in.
perfect. Thank you.
Thank you very much, everybody. We will call this meeting of the March 10th Community Safety Standing Policy Committee to order. I would like to start with the acknowledgement statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future, while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. The City of Lethbridge is also the home to the Métis Nation of Alberta, Region 3. Could we do a roll call?
Sure. Councillor Campbell,
I'm here.
Councillor Middleton Hope,
Here.
Councillor Parker,
Here.
Councillor Schmidt Rempel.
Here.
So we have all four. We have all four members of the Community Safety Standing Policy Committee in attendance. We have a quorum. In addition, we have other members of council, including Mayor Higgin and Councillor Carlson.
Thank you very much. We do have an in-camera section to this meeting, but we are going to move that and do that at the end of the meeting instead of at the beginning like we normally do. So I trust everybody's had an opportunity to take a look at the agenda. Do we have any changes to that agenda, Mr. Sarsfield?
None.
Can I get an adoption or a motion to adopt the agenda? Councillor Parker, all in favor? Did we have any opposed? John, were you opposed?
Madam Chair, we'll just, if we hear silence on the opposed, we'll just take that as everyone's in favor.
Yep. Has everybody had an opportunity to take a look at the consent agenda? Do we have any questions, comments, concerns with regard to the consent agenda? Could I please have the motion, be it resolved that the minutes of the Community Safety Standing Policy Committee meeting held on February 10th, 2022 be approved and the Mayor and City Clerk be authorized to sign the same, and further be it resolved that the status and initiatives of the Community Safety Standing Policy Committee from February 10th, 2020 be approved. Could I have that motion, please? I'll take Councillor Campbell on that one. All in favor? Excellent. We will move on to presentations. We have a presentation from Michael Bowe, CWSS Manager, regarding Community Wellness and Safety Strategy Administrative Update. Mr. Bowe.
Good afternoon, members of council and administration. I actually would like to request a shortened presentation be uploaded to allow for more questions at the end of the presentation. We're good. Good afternoon, members of SPC and members of council. My name is Michael Bowe. I am the manager of the CWSS team. In today's presentation, I will define our team's role and provide an update on key projects and initiatives. Next slide. The Community Social Development Department is comprised of two teams. The Grant Management Team administers and manages all City of Lethbridge social grants. Takara Motz is the manager of this team, and she'll be providing an update at the April SPC meeting. There's also our team, the CWS team, under myself, newly formed since last summer and just recently fully staffed. The CWSS team has a broad portfolio. Key roles include implementing City Council approved strategies, providing ongoing backbone support to key committees such as the Community Wellbeing and Safety Committee, the Social Services Integration Group, and the Clean and Safe Committee. As well, implementing and managing key programs and projects. Next slide. Unlike other municipalities, we don't deliver social programs. Our role is to facilitate, coordinate, and convene the community to generate solutions and collective impact to address social issues. No one organization or level of government can solve these problems. This is a community problem that requires a collective solution. All levels of government must come together with key community stakeholders, including the police, the education system, the faith community, and service providers, to name a few, to both leverage and coordinate all available resources and identify and implement key actions to achieve success. The three key strategies we manage are the Community Wellbeing and Safety Strategy, the Community Clean and Safe Strategy, and the Municipal Housing Strategy. Phase 2 of the CWSS was unanimously approved by City Council in 2021. At that time, Council directed us to support the interim CWSS Advisory Committee as they designed the governance model for the CWSC. The proposed model has been presented to the SPC with a revised draft coming back to Council on April 5th. Next slide. As mentioned previously, the CWSS team provides backbone support to various committees and community groups. The term backbone aligns with collective impact models and methods. The backbone organization is responsible for convening, facilitating, and coordinating relevant groups and resources to generate collective impact. As such, our role includes convening diverse stakeholder groups, administrative functions, research, data collection, analysis, data management and reporting, community capacity building, education and training, preparation of reports and studies for the community group's consideration, and coordination, implementation, and managing of programs and initiatives. As the backbone, we support the community groups as they work towards true community-wide collective impact. Next slide. Several key initiatives being proposed or in development that have also been recommended by the Clean and Safe Committee include a public washroom audit and a safe security strategy. Both initiatives are listed on Council's action plan. As well, we have funded some successful initiatives being led by Lethbridge Police Services, such as the Youth Outreach and Engagement Program and an awareness campaign, Stop the Op, which has been a very impactful initiative. Next slide. Unlike many municipalities, the City of Lethbridge does not own or manage social or affordable housing. CSDA has led the development of the city's first ever municipal housing strategy, and a key role of my team is to implement this strategy. This work includes promoting collaboration and partnerships between housing stakeholders, advocating for capital and program funding contributions, proposing changes to ensure barriers such as permitting, zoning, and regulations are minimized to create that fertile soil for housing projects, providing adequate administrative services and support to ensure projects are completed in a timely manner and with minimal frustration. Our newly hired MHS specialist is developing the Affordable Social Housing Capital Grant application package and process, while at the same time working with numerous organizations to complete and submit grant applications. We're building that bridge as we walk on it. Some of the other areas our MHS specialist will support is developing project tracking and reporting tools, developing and implementing education and awareness programs related to social and affordable housing, supporting opportunity leverage with the social land banking project through the lens of the MHS, reviewing and recommending innovative solutions to address our community's social and affordable housing needs, and lastly, working with community groups pertaining to housing gaps and needs. Next slide. In addition to the new initiatives being proposed by the new Clean and Safe Committee, our team is constantly working to manage existing Clean and Safe programs. What was originally called the Downtown Clean and Safe Strategy has now been expanded across the entire community. We currently manage over 10 different programs, including Diversion Outreach Team, Clean Sweep Program and Hotspot Cleanup, Biohazard and Encampment Cleanup, Neil Debris Hotline, Safe Community Call Center, among a few. In addition to these programs, we are supporting the Clean and Safe Committee to review existing programs and implement new programs and initiatives. Next slide. The Diversion Outreach Team is operated by Canadian Mental Health Association and offers a mobile diversion response to the vulnerable population who may be facing homelessness, mental health concerns, or addictions on the streets of Lethbridge. The DOT program connects vulnerable individuals to supports such as Alpha House's Intox facility. The program averages around 170 referrals per month, with the heaviest concentration in the downtown. Next slide. The Safe Community Call Center serves as a single point of entry for the community to designated services. Currently, the SCC is operated by CMHA, which triages and responds to issues such as unsafe street behavior, public biohazards, encampments, and Neil debris. The SCC operates from 8 a.m. to 4 p.m. and has been in place since October 2019. Most calls come from businesses or agencies, with the majority of requests around needle debris and biohazard concerns. Next slide. The Clean Sweep program, this amazing program the city has, strives to employ the vulnerable population to gain employment skills and the tools necessary to re-enter the workforce. This program is operated by the Downtown BRZ and helps to keep downtown streets and sidewalks clean. The program collects on average 445 bags of garbage per month, and as well, the program collects needles and other drug-related debris. And that number of needles collected in the community has actually increased significantly over the past 2 years, as you can see. Next slide. Following the closure of the Safe Consumption site, the Government of Alberta partnered with the City of Lethbridge to leverage the Downtown BRZ's Clean Sweep program. In partnership with the Clean Sweep team, we have redesigned the program, increased service levels, and reduced operating costs. We are in the process of signing a 3-year contract with the Government of Alberta for the following key services: daily operation of the needle hotline, emptying public needle boxes, collection and safe disposal of needles and needle debris, regular sweeps of high-volume locations, as well installation and piloting of a new heavy-duty needle box, purportedly break-proof. In 2021, we had significant challenges with needle boxes being broken into, and therefore, under this program, new needle collection boxes will be installed and evaluated in the coming months. Next slide. A foundational service in this program is our needle collection hotline, which is operated from 8 a.m. to 4:30 p.m. daily. On average, the hotline receives around 8 calls per day, and an average response time of 14 minutes. And around 460 needles are collected per month. Next slide. We also have a biohazard and encampment cleanup program, both triaged through the Safe Community Call Center. These programs support the safe cleanup of defecation, blood, and other biohazards. In addition, we collaborate with outreach teams and LPS to address encampments. With the reduction of public washroom access during the pandemic, biohazard cleanups increased significantly, with encampments also increasing year-round. Next slide. Here we have a map of the various encampment cleanup locations. There was a 50% increase in encampments year over year from 2020 to 2021, with the overwhelming majority of encampments in the Senator Buchanan area and the south seeing the next largest in the downtown or Cooley areas predominantly. Next slide. Additionally, private security coverage is provided for several city facilities, including CASA, SAG, Park and Ride, and a mobile patrol of Galt Gardens seasonally. Overall, less than 7% of all incidences were high severity. However, we have observed an increase in low to medium incidences through 2021. Next slide. We are constantly reviewing and evolving programs and services to address ever-changing needs. Recent changes include expansion of the Clean Sweep program in late 2021 to serve the shelter area. We're also looking to expand the biohazard encampment program. We've added a new outreach mobile team. The OMT is a best practice model with a strong focus on building street-level relationships with clients and connecting them to recovery-based services. Coordination with this team and other services such as the Sage Clan and Streets Live is a fundamental aspect for this program. We are currently also exploring the concept of moving SCC to the PSCC. Our hope is to create efficiencies and provide a 24/7 service. Next slide. Whether we are being directed by the various committees, City Council, or administration, we are constantly exploring, studying, or developing business cases for new and innovative initiatives. Some of the current projects include several initiatives on Council's action plan. This includes the evaluation of a community care campus, homeless shelter initiatives such as the interim sober shelter, as well as a motel crime reduction strategy. Additionally, we also support and coordinate several community grants or assistance programs, including the CCPG grant, the Fee Assistance Program, the Community Event Support Grant, and lastly, support with the City Manager's Office Courtesy Use Policy. As well, under that backbone support umbrella, we also provide support with various community engagement groups such as Lydia, Shenla, the COVID Leaders Group, as well as the Finding Solutions Committee. Next slide. Incorporating City Council and corporate strategic priorities into our work is always front and center. For example, regarding partnership excellence, we are currently partnering on several different initiatives, including the Palix Foundation and U of L to expand and implement the Brain Story in Lethbridge, the United Way to develop and implement a social impact lab, Shenla to develop a current poverty report for Lethbridge, and the U of L and RLAC to complete a Lethbridge-focused addiction study. One of our key priorities is cultivating a vision of community well-being that is effective and inclusive, and critical to this is ensuring an Indigenous cultural lens is integrated in the initiatives, programs, and projects our team oversees, as well as those programs under the grant management team. And then lastly, we are also an intake for community concerns around social issues. We triage and connect with the community and ensure that the information is shared to existing services, city services, departments, or partnering services or organizations within the community. We are the CWSS team, and this is what we do. Thank you.
Thank you very much, Mr. Bowe. I will take questions from members of council. Councillor Campbell?
Thanks for the update, Mr. Bowe. I appreciate that. I was just curious about...
You're on mute, Councillor Campbell.
Quote of 2021, 2022.
We still don't have you, Councillor Campbell. Can you, I was going to say, can you log off and then come back on and we'll see if we can get you there? Okay. I see Mayor Higgin has his hand up. It could, yeah.
Hi, Blaine. I'm just
Yeah, we're not.
Jen right now. I think the error is in James. Yeah.
Yeah, I agree.
Okay.
Just let her know it's John actually that's got the question. But.
Yeah, okay. Go ahead, Councillor Middleton Hope.
Okay. Can you hear me, Jen?
Yes,
Jen,
we
can. You hear me? Okay, there we go. So, Mr. Bowe, thank you very much for your insightful examination of our status update. I would encourage you, however, to use a term that is perhaps more reflective of safe consumption sites. They are actually not referred to as safe consumption sites. They're supervised consumption sites because there is nothing safe about illicit drugs. So I would encourage us to be using language that is perhaps more reflective of the reality. Other than that, I think the presentation was exceptional. Thank you very much.
Thank you, Councillor Middleton. Hope I will definitely change those going forward.
Do we have any other questions from members of council? We're still waiting to see if Councillor Campbell logs back in here. Any other questions, though? All right, seeing none, could I please have a motion? Oh, okay. There's Councillor Campbell.
Can you hear me now?
Yeah, we can hear you now, Councillor Campbell.
Oh.
Go ahead.
Oh, what was my question? Okay, I don't know if it's was asked. I'm just curious about since the safe consumption site shut down, there's still a harm reduction van or a mobile unit that's still downtown. What's been what kind of action? What's the word? How busy is it there? And the other question I was going to ask where are people getting their needles? Does Arches still provide needles for everyone in that situation?
I believe the needles are being handed out through OPS as well. AHS, I think, has a mobile team that goes out and provides needles at designated times. I'll also refer to refer to Marty on Thompson on the actual usage of the OPS in terms of how much.
Yeah.
Councillor, yes, the Arches used to have the contract for harm reduction supply distribution, and that has transitioned to Alberta Health Services. Now, they leverage both the OPS, which is located in front of the shelter, and also supplies can be received from Alpha House inside the building if requested. And the level of use of the OPS, is that a question you were asking?
Yeah, just compared to what we had at the old Arches site.
So the usage is significantly lower, but you also have to consider capacity too. There is only a limited number of capacity. It is a mobile site, and there's only 2 bays. And whereas I believe, and only one method of use. So the supervised consumption site had all 4 modes of use, injection, and the different inhalation and so forth. And so it's tough to compare usage because, again, capacity and the modes of use. We do get weekly reports from the province on the use, and I can forward them to the city manager so you can have an idea. But we're looking at, and I don't have the numbers right in front of me, so I preface that, but about 146 unique uses per day.
And it seems because of the number of needles that are collected by the Clean and Safe program, there's still a significant number of needles being used in the city, even compared to what Arches was doing, right?
Yes, as you can tell by the data, we're still collecting a fair number of needles. But again, it's really tough to compare the use of the SCS versus the OPS because there's, again, COVID. COVID has had a dramatic impact on the types of drugs available, the usage trends, and all of those different pieces. And so are there still, a high usage of needles? Yes. But we're constantly monitoring that. But the good news is, if you look back, about 4 years ago, our community, we had a lot of discarded needles in the community. And I'm going to toot our horn here a bit. A large reason on why we're not having a lot of those problems is we've got some great partnerships with the Clean Sweep program and some great processes and tools in place to get those needles collected to keep our community safe.
And I mean, one of the big parts of the harm reduction model was to have information available to those who wanted it. Does that continue to go with the mobile site as well? And is there success rate in getting people to the help that they need?
Yes, so there has been I would say, a marketed shift towards that recovery-based model of connecting the substance users to services. And so front and center to the OPS is not only the use, but that ongoing encouragement to connect to the recovery-based services. And that's not only the OPS, but it's in Alpha House. The city of Lethbridge we are about to, not the city, but we're funding organizations. We've just to modify our outreach program. And so there's going to be a real purposeful effort to have on the ground, in the trench outreach workers that are going to be constantly moving in and out of those high hotspot areas, Galt Gardens, in and around the OPS, to build relationships and connect clients to available services. Now, again, to connect them to services is critical. So having Fresh Start now in our community and having the different intox and detox programs is very beneficial because we can connect those clients, build relationships, refer and connect them to services. So not perfect, but we're moving definitely in the right direction.
That's great. And just one more thought, Madam Chair, if I may. Just I know that there's harm reduction advocates that want to. We've seen pop-up tents and things like that. Do we have any sort of communication with those people who want to continue on that world, or is there? Do they do their own thing and we just do the city's own thing?
You know, the use, monitoring, funding of consumption services, as we all know, is directly the mandate and responsibility of the Alberta government, and specifically the addictions and mental health. And so as a CSD department, we don't have really any contact with the different groups that are trying to set up parallel services. I can tell you, though, and I'm confident everybody is aware of this, that that Alpha House, Alberta Health Services, and the Alberta government, of course, is exploring, the use of the OPS, integrating services with the intox and detox programs and so forth, again, to make it that seamless, effective recovery-based service.
Thank you. Thank you, Madam Chair.
Thank you. Councillor Middleton Hope.
Thank you, Madam Chair. This question, I guess, is either for Mr. Bowe or for Marty. You indicated that there are some challenges in regards to needle recovery. Is this a resource issue, Marty, or is this just a matter that we haven't decided, where we haven't found a satisfactory recovery mechanism yet? What's the issue?
So are you specifically talking about the needle collection boxes? Because
yeah,
when the supervised consumption site closed, there was a bit of a gap on getting harm reduction supplies to the community. And because that service went from Arches to AHS. Now, you have to understand, the client population, change is often difficult on them. And so it takes time for them to recognize that services and resources are being distributed through a different forum. So what happened is virtually every one of our needle boxes was broken into, and they would, of course, take the used needles to use them because they didn't have access to a clean supply of needles. Now, this is challenging because the needles are meant to be single use, and if they're shared, of course, it is the transmission of HIV, Hep C. If they're used more than once, often they'll damage the blood vessels and you'll get abscesses. And so the negative impact of using or reusing needles can be quite expensive to the system. And so we've worked with the Alberta government to get some funding to pilot and develop some new, for lack of a better term, sturdy, kind of tamper-proof needle boxes. And we're in the process of installing them right now.
Yeah, that's helpful for sure. As long as there's a solution downstream from it, because the accessing of the needles not only is because they don't know where to get more cleaner needles and so forth. As you're well aware, it's the opportunity to flush with existing substances in the needles. So we want to avoid that as well. As you indicated, it's a health issue more than anything else.
Thank you.
Councillor Carlson.
Thank you, Madam Chair. Through you to either Mr. Thompson or Mr. Bowe, if I can. I'm trying to read the data here, and I think it's on the page, the slide deck. I don't have a number. It's about the Clean Sweep program. It kind of ties into what Councillor Campbell was asking. And maybe I'm reading it incorrectly, and I appreciate that we're doing a great job, or a better job, of collecting needles and cleaning up needles in our community. But help me understand that slide. Is that slide saying that actual needles in the community that people are calling about and were being collected has skyrocketed since the closure of the SCS?
Excuse me. I wouldn't say that it was necessarily from the SCS, but also through the pandemic. We have seen a significant increase. As you can see, the amount of needles for 2021 are significantly higher than about 2.5 years prior to that, between the downtown and the hot spotting. The shelter expansion was a brand new project that just started in September of 2021, and obviously is a very concentrated area that has a lot of needles cleaned up. So yeah, in a sense, it's both, I think, the closure of the supervised consumption site and the pandemic that have increased the amount of needles collected significantly.
Because it seems rather shocking to me, because I know that the narrative in community was that the SCS was the cause of all the needles, and since the closure of that, it seems that the needles in our community have skyrocketed. So that's kind of surprising to me.
Also, and from some of the data we did glean, is that needles, biohazards, and encampments have also increased significantly from 2020 to 2021. Biohazards hasn't. Actually, the biohazard cleanups have kind of stayed steady. We originally put in some public washrooms in the summer, and we didn't see a drop. So we first assumed that it wasn't as big of an impact. But then seeing the data from 2020 to 2021 from encampments, needles, and garbage and other increases being significant with the biohazards, the public access washrooms were most likely an impact. But yes, it's a combination of both the SCS and the pandemic.
Thank you for that. Interesting to note. I'm going to have to mull that. Thank you.
Thank you, Councillor Carlson. I see we have another question from Councillor Middleton Hope.
This is a question to Mr. Bowe, just so that we're clear on your comments in regards to debris. The causes of the debris are likely multifactorial. We've had some indication that it may have been as a result of the supervised consumption site. It may have been as a result of the pandemic, but I think it's safe to say that it's multifactorial. Is that correct?
Yes, sorry. When I say the changes happened, I think both You could see it with the SES closure and the pandemic. The reasoning for those obviously is, very multifaceted and would require much more data and investigation.
Right, and I think you also said earlier that the issue, or at least Mr. Thompson did, indicated that there have been problems with storage and collection and so forth. So again, this might very well be components that are contributing to our examination globally, of an increase or a perceived increase in debris.
Yes, yeah. We do also have a couple slides that show the differences between the biohazard cleanups between the SES closure and the pandemic. And you see with the SES closure, the biggest impact is the concentration of cleanups are no longer around the SES in downtown. They've increased throughout the Center Buchanan area and down to 13th Street. And then the pandemic, obviously, with biohazards, it has increased significantly in concentrations and number of cleanups.
Right. Good. Thank you very much for that. I appreciate the clarification.
You betcha.
Councillor Carlson?
Thank you, Madam Chair. I guess following up on that, if I can, are we doing any work, you said without, I think Mr. Bowe answered, without further study, we wouldn't really know exactly what's causing it, but are we doing any work to try and find out? As I said, it seems counterintuitive to the narrative in our community that the SCSS caused all the needle debris, and since its closure, we've seen a huge spike in needle debris. It seems to me that I don't want to jump to causation or correlation, but that might be something worth exploring to find out whether it was having a very positive impact in our community, and it's something that may be necessary to kind of stop this needle debris from impacting our community. Are we doing any work to find out what the best practices and how we could impact that would be?
Thank you, Councillor Carlson. So at this point in time, no, we're not. Right now, we have data in front of us simply demonstrating, the number of needles we've picked up, and we have not went into that causation piece. We can only, anecdotally, explain why. But the question would be, I guess, back to council, do you want us to do that? I mean, needle distribution and needle usage, is really the mandate of AHS. Now, needle collection, as we know, is part of the city mandate. And if that is something council would like us to do or direct us to do, we would lean to you for that direction.
And thanks, Mr. Thompson. I guess the reason being, we can keep spending more and more money on needle cleanup, or if we can find out a way to go upstream and stop it at what's causing it, that seems to be a much more cost-effective manner than just throwing more money at cleanup if there are opportunities to control it actually appearing in the first place, or at least limit it. So it'd be something for me that I'd love to know what we should be advocating for our community.
The good news is, again, although I do recognize tax dollars, whether they come from one level or the city, it's still tax dollars, but this is funded through the government of Alberta. But what we can do is, through our contacts, at least present that or collaborate with AHS to see if they have done any of that work, or if we could potentially collaborate with them on that.
That would be appreciated. Thank you. Thank you, Madam Chair.
Councillor Campbell?
Thank you, Madam Chair. Just, I'm really like Councillor Carlson, I'm surprised at the number of needles that we continue to pick up. But I just wonder, because there was such outrage in the early going about that, so it's obvious that you're doing a tremendous job, but is there still outrage amongst probably mostly business people about the number of needles that are there, or are they saying, fantastic, you're doing the great job, keep it up? What's the general consensus? And I suspect mostly of business people in the areas that the hot zones are.
Well, that's definitely a question I wish that the BRZ were here to be able to answer, because they are the front line for a lot of those businesses. But from what I've been told, and as you know, there's always upset businesses. I think the Clean Sweep program is amazing at going in and cleaning up and collecting those needles through the needle hotline. They have a very fast collection time, response time. So I think in that sense, the business community does know that they're doing a great job. But I think with any, every business, waking up or opening up their stores in the morning and seeing needles is frustrating. The majority of needles and needle debris hotline calls do come in through the mornings, and that's pretty much when they're picked up throughout the morning hours. So, not sure if I answered the question, but.
Yeah, I don't know what the perception generally is in Lethbridge, comparatively speaking, because again, it was such outrage in the beginning, but it seems to have, at least in my mind, gone away to an extent. I don't know if you feel that as well.
I do know in our needle debris reporting for the GOA, we've had very positive input that the Clean Sweep program has put down. It's usually more positive from business owners or individuals that encounter them during the cleanups and the collections than it is upset.
Okay, that's good. Thank you.
Thank you, Councillor Campbell. Do we have any other questions? Seeing none, I do have a motion. Be it resolved that the Community Safety Standing Policy Committee receive the presentation and report for information. Could I please have somebody move that? Councillor Parker? All in favor? Do we have any opposed? Hearing none. Oh, Councillor Campbell?
Oh, no. In favor.
Okay.
Sorry.
Excellent. Thank you very much. Thank you very much, Mr. Bowe, for your presentation. Next, we have a submission from Mr. Enns, General Manager, Regulatory Services, re-action on smoking and health bylaw. So we have a motion in front of us. Be it resolved that the Community Safety Standing Policy Committee recommend that Council receive and report information and give first reading to bylaw 6357, a bylaw to repeal smoking bylaw 3896. Do I have any questions at all from members of Council? Oh, could I get a mover for that, please? Councillor Campbell?
Yeah, sure.
Do we have any questions at all for Mr. Enns? Councillor Carlson.
Thank you, Madam Chair. Just a question on the communication strategy. When you remove a smoking bylaw, it may spur members of our community to think that we are lessening our restrictions. And I think, I just wonder if there's going to be a communication strategy to say, no, the province actually has tighter restrictions, so we're following theirs. Is there a communication plan? Is my question.
Yes, we haven't had detailed discussions with communications, but we're certainly going to get them involved in this, and that is certainly something we want to get out there into the community. You're right. There are a lot of regulations out there, provincially based, and we don't want people to think it's a free-for-all. So you're right, Councillor Carlson. We're definitely going to engage with communications to do that.
Excellent. Thank you, Mr. Enns. Thank you, Madam Chair. Councillor
Campbell?
Yeah, thanks. If I could just get the Coles Notes version of what is going to be the big change. I know that there's going to be a better bylaw, but ultimately, what are the key points of the changes that we will see in the new bylaw?
Oh, well, actually, we're not. What we're doing in this particular case is we're repealing the bylaw.
So it's going to be a go away.
Yeah, we're repealing the bylaw, and the reason we're asking that is because when this issue came up, we realized that it was actually in 2007 that the city of Lethbridge passed their smoking regulations, and they had a number of unique things such as patio renovations and stuff that the businesses went out and did and everything else. And it wasn't more than a year later, it was in 2008, that the province came with much more restrictive rules in place. We had lesser rules, and then the province came in, and it basically made our bylaw redundant. And the province has now, in 2021, actually increased even further some of the restrictions in this area, and they've actually put resources into enforcing it. So when we looked at this, we said that our bylaw is kind of redundant. It's actually redundant, and it's kind of confusing to the public at large that there's, we have this bylaw in place, people can take a look at it, and they don't know that the provincial regulations, the ones that actually supersede the provincial, or the city ones. So that's why our recommendation in this particular case is to withdraw, or to repeal our bylaw, and rely on the province's rules in this particular area.
Good. Thanks for the clarification. Appreciate
no problem.
It. Thank you.
Do we have any other questions from members of council? All right, seeing none, we have the motion by Councillor Campbell. Could I?
Call.
Yeah.
Call for the vote.
All in favor? Do we have anybody opposed? Hearing none, thank you very much, Mr. Entz, for joining us.
Thank you.
We will now move into a closed session. Could I please have a motion to move into the closed session? Councillor Campbell? All in favor? Do we have anyone opposed? No, we will move into the closed session. And we'll just give a few minutes to switch that over. All right, back into our public session. So I have a motion for contract negotiations. Be it resolved that the Community Safety Standing Policy Committee recommends that Council direct that the closed meeting discussions, reports, documents, and attachments with respect to contract negotiations remain confidential pursuant to Section 16, harmful to business interests of a third party, 21, harmful to intergovernmental relations, 23, local public body confidences, 24, advice from officials, and 25, harmful to economic and other interests of a public body of the Freedom of Information and Protection of Privacy Act. Could I please have that motion? Or a mover for that? Councillor Parker, all in favor? Do I have any opposed? Seeing none, thank you very much, everybody. That is our meeting. I will close this meeting of the Community Safety Standing Policy Committee. Thank you.